The coffee break conversation. Briefly, statistics revealed that 2.5 million Ugandans had both moderate and severe eye-related impairments. Approximately 150,000 are completely blind, that is 0.4%. The Ministry of Health's report indicates that 57.1% of the blindness in Uganda is caused by the cataracts, while uncorrected reformative errors are the commonest cause of the visual impairments. And now today, I'm joined by Oco Lilian. She is from Mengo Hospital, the eye department. And I want to look at living with glaucoma, and of course, from diagnosis to daily care. What does it imply? And to the layman's understanding, Madam Lilian, it's a good pleasure to have you on this topical conversation.
Thank you so much.
Okay.
I'm Lilian, a clinician working with Mengo Hospital Eye Department, and as the department, we are so glad to be hosted to give some knowledge about what we do, and this is mainly in regards with glaucoma.
Yes.
Glaucoma in layman's language, you could simply term it as eye pressure disease.
Eye pressure disease.
Eye pressure disease. And for eye pressure disease, though it is the second leading cause of blindness, but when you talk about as irreversible blindness, which is blindness which can't be taken back, or whereby vision cannot be taken back, it is the leading cause of irreversible blindness. So we are glad to share it because we know that eye pressure disease or glaucoma, the end result of it, if not duly diagnosed and treated well, we know that we may end up with complete blindness that cannot be reversed, and that has a lot of impact on the life of any individual who has got it. And glaucoma, we usually refer it as the silent thief of sight, because most type of glaucomas are really painless, except a few. So a person usually is not aware about the disease because there is no pain in most cases. So what glaucoma does really is to cause damage to the optic nerve, which is what takes message from your eye to the brain. We know that as eye health care workers that the eye's work is to collect messages for you to be able to see, but it is the work of your brain to be able to see. So there is what we call the nerve, which is responsible for taking that message from your eye to the brain such that you might be able to see. And this is the nerve which is usually damaged in glaucoma, and whatever damage happens to its cells is permanent. And that's why it's so much of concern to the public, because we know that whatever damage happens on the optic nerve is permanent. And actually studies show that about 40% of glaucoma case, 40% of individuals, the studies show that 40% of your sight, of most individuals, sight is lost 40% before they realize that, okay, there is trouble here with my vision. So usually 40% of the sight is gone before someone can really appreciate that there is trouble in my vision. And so in regards to glaucoma, in most cases when you go for eye checkups, the main things you will hear about the eye checkups will be your vision test, it will be your eye pressure check, and imagings depending on what has been seen there. And when we get to glaucoma, we know that we might not have very much concrete studies in prevalence as per Uganda, but as per 2023, it's 4.8, but we know that it's 0.007% of those that are really diagnosed. And that 0.007%, it's really a very small percentage, meaning that about 685 will go undiagnosed, really. So that is why we are here today to share with you what glaucoma is all about, because we know that it has a lot of impact, not only on an individual life, but the general community as at large.
Yes. Briefly before you proceed, what are the causes? How is it? How does it manifest? Maybe in the simple terms.
Causes of high pressure disease. What really happens is that we have fluid in our eye, or water of the eye, that brings nutrients for your eye to be normal.
Yes.
And every day the eye produces that water, but the water is supposed to be drained out. But for some people, the passage or the place which takes out that water is not taking it out well. Some might be taken out, but some is remaining, and another is being continuously produced. So it builds up what we call a pressure inside your eye. And because the optic nerve, or the tube which takes the message to your brain to be able to see, is relatively at the center and in the back, it is the place which gets more pressure put on it, and slowly the nerve cells keep dying off, and that process is permanent, unfortunately. And unfortunately, in the early stages you won't notice because you might not feel pain, but glaucoma has the eye pressure disease has types. Though we know that the most common type is the open angle, meaning that the place where the fluid passes, or the water of your eye passes, it is open, but there is build up of pressure because it's open but inadequately moving out that fluid of the eye, and that is the most common. But there are other types that will come as a result of blockage, or when there is blocked passage of the fluid, and there are those that will also happen when it's open. But the most common is open angle glaucoma. Though there are other types you will know about, that there is a closed angle whereby the passage is literally blocked. But the most common that we are dealing with commonly, it's the open angle glaucoma, where the eye pressure is happening but the passage is open, and that is the most common. And because it's painless build up of pressure, usually the people will not notice until it's in later stages. Unlike for the closed angle glaucoma, usually the person notices because it's associated with pain, because it's certain blockage of the fluid and sudden build up of the pressure. So that's the little that we can elaborate more about this disease as a whole.
As a nurse, can I call you a nurse, please? Okay. And what percentage have you realized that when it comes to the population of Ugandans, is this disease mostly common in the young children, the adults, or these old men and old women, according to how you've been dealing with this kind of a disease in the patients?
Okay, for the age, truth be told, glaucoma, commonly you find it in people that are age 40 and above.
40 and above.
But that is a disclaimer, reason being that glaucoma does not only affect the elderly. It's a main thinking that the elderly will be affected. The only thing is that which makes it common in people that are more older, it's because that's when they realize the damage is there and they come for the checkup. But you find glaucoma even in the babies who are born with it, what we call congenital glaucoma, because where the water of the eye passes wasn't formed during when they were in their mother's womb, so the passage is not open. You find glaucoma even in people that are youth, because of build-up of pressure in the eyes, and so it's not that glaucoma can affect any age. It can affect any age, though sometimes we see them in the older stages when already damage is there over years. But it's not linked to a particular age. Anyone can get glaucoma at any age.
Okay.
Yes, please.
Interesting. And maybe what I wanted us to kindly elaborate on. And most of the times you talked about the young children, maybe these newborn babies. How can a parent know? Because I do believe there's some parents out there who have no knowledge about this.
When a baby is born, the eye has to be clear. The black part, what you would call the black part, it is the glass of the eye. Actually, it's clear. Okay. It's black because what is inside, you can see through it. But for congenital glaucoma, when a child is born, you find that what would be the cornea, which is the black part of your eye, is really bigger than normal. Okay. Now, some people might give birth to babies and they see the babies have big eyes. And big not eyes. Every child who has a large eye means that they have glaucoma, but for glaucoma it will be a little bit bigger, what we call a large cornea. Okay. And also that cornea, in most cases, when you read, you will find that they talk about a bull's eye, because a bull's eye, like a cow, it's a bluish, bluish and whitish. So you find that for congenital glaucoma, these children, their corneas are wide. They are really big. That what you would see as the black part of the eye is really widened out, and it's not clear. Okay. For clear, you can see that it's black, but for it will be grayish blue in most cases. So, and also these babies will have very teary eyes, and sometimes they are very light sensitive. When you shine a torch, it will be tearing, and the baby will be closing the eyes because they are very sensitive. And that is commonly what you will find: a largened eye, the largened cornea, that black of the eye, and then it's bluish in color or whitish. It's not clear like the ideal eye, what you would look at it. So if someone sees that, what would be important is you to think about really going for the eye checkup, because sometimes being not in the medical eye section, you might not know that this is suggestive of glaucoma, but at least if you go, the anxiety, if you come to us, the anxiety will be allayed. Yes, please.
If not treated earlier, what are the outcomes of this?
When glaucoma is not treated earlier, what happens is that that continuous damage on your nerve, which takes message to the brain, it causes loss of vision. Okay. And in most cases, we look at loss of vision, but there are instances whereby even when loss of vision is there, when the eye pressures go very high, the eyes become painful, and then they're still not seeing. The person is in pain, but the eye is also not seeing. So one of the repercussions, the concerns, is about mainly vision loss, which vision loss you can't really take back. Exactly. And that is why it is like a concern so much, because you know at the end of the day it's going to affect not only that individual, but the whole line of the people that are behind that individual, who are maybe being sustained by that person, if it's a parent, and also for if it's children, you know that there will be a burden in how to raise this child without vision. Yes. Yes, please. Is
there a treatment that you have as Mengo Hospital that can be able to, because we do not know if the treatment that is available can be able to deal with this thing away, or it's just a process, or the treatment that you have, it just tries to clear out a certain way somehow? I don't know.
There is a myth. And our patients sometimes also ask that, sometimes not because they have not had the information given to them, but there is that plea of desperation. What else can be done for me? So in the management of glaucoma, we have various ways of managing it. And we are blessed as Mengo Hospital Eye Department that it's a comprehensive center. Our eye department is a comprehensive center. We have whatever it takes to diagnose the glaucoma. We have what it takes to investigate. We have what it takes to confirm the disease. And also we have what it takes to treat it. And we have in the treatment, in the management of glaucoma, it all starts with you knowing what you're dealing with, and that is with the diagnosis. So when you're coming to Mengo Hospital, it's a comprehensive center, because as we do the management, we need to know what are we really dealing with when we confirm this disease. And in confirming, we are dealing with your vision test, we are dealing with your eye pressure checks, we are dealing with the images, investigations that we do, because we know that the glaucoma treatment is a lifelong treatment. So in most cases, you do not want to start treatment when you have not confirmed the disease. So in most cases, we don't just look at the eye and say this one has glaucoma, or do the vision test and say this one has glaucoma. But we need really to do a comprehensive check for you to be able to appreciate. Now, looking at the management of glaucoma, we have 3 modes of management. Well, we have the eye drop installation, putting of eye drops, and these eye drops, their role is really to reduce the pressure inside your eye. And most of the challenges that we get with the eye drop putting, we just as we have said, it's a lifelong treatment. So because it's a lifelong treatment, given our environment with the financial status, we give the eye drops, but studies show that given in our environment in developing countries, sometimes affordability of the eye drops, the distance where to get them, the availability wherever the patients are, it's really tricky. So the ideal treatment, which we also have in Mengo, is surgery, given those nitty-gritties in affordability of the medicine, the consistency. People get worn out and tired of putting this medicine all their life. So studies show that the best would have been surgical intervention, and surgery, it means that they are operating the eye to put another passage to act as backup for the passage that is not taking out the fluid in the eye very well. But currently in Mengo, we are treating with medications. Those are the eye drops. And if patients consistently put these medicines and they do it well, they really, the pressure lowers and you reduce the chances of blindness. But there is surgical intervention, there is laser, and all these can be used as per one intervention, or it can be used as a whole as a whole intervention, because there is a time when you're treating with the eye drops medication, and really the pressures are not going down. And if the pressures are not going down, usually we do assessment to know, is it the trouble of the patient applying the drops, or is it because the drops are not really lowering the pressure as we want. So in management, how we manage in glaucoma in Mengo, if one intervention is not helping the patient well to reduce their pressure, usually we add on another intervention. So it's not a one-off for every patient. And what we have to know about this disease, people might go out there and tell others, for me this is what they did for me in treatment. But this treatment vary according to individuals, depending on how you're responding to one also. The people, we have done surgery in Mengo, which we call trabeculotomy. We have done surgery, and still the pressure is low, but not as the best we want. And you'll find that sometimes we have added on an eye drop, which lowers eye pressure. So it's not a one-off, and treatment for eye pressure disease is highly individualized, meaning that it depends on individuals, it depends on how much pressures they have, depends on what is causing that pressure to go high, and that is the management you give. But currently in our eye department in Mengo Hospital, we are comprehensive, and even with the investigation, we are very, very comprehensive. We have all the machines it takes to diagnose the disease, and that we are doing consistently. consistently, but we have to know that this disease, you can't diagnose it without really doing an eye checkup that is comprehensive. Right. Comprehensive means that the eye checkup has its conclusive, it has everything contained in it, not just to bring a torch and torch in the patient's eye to see what is happening, and maybe just to look and you see, okay, this child has glaucoma. Currently in Mengo, we can even test for eye pressure levels in the babies. We can test for it. We have what we call the eye care tonometer. It doesn't need a lot of manual work and cooperativeness of a child. You can do eye pressure check even for a 1-month-old. You can really do it with that machine. Okay. So we are comprehensive, and when you come to the center, it's really a good experience in knowing whether you're okay with glaucoma or not.
Yes, we have seen our patients with such kind of a disease, and most of the treatment that we have seen them using is the eye drop. I don't know, how does that eye drop work? Briefly. Then number 2, you give us which other treatment is more preferable as the doctors in charge with the eye treatment. Which second option of the treatment do you recommend such kind of patients to go for? Besides the eye drop, because for that one we have seen it's common. Briefly.
Besides the eye drop, we have the surgery or the operation.
Yes.
And just as I've mentioned before, given our environment, our income, and our people that we are dealing with, surgery would be a good option. Reason being that people sometimes cannot afford consistency of medicines for all their lifetime. So the ideal in our environment, in our developing countries, would be the surgical intervention, because you know that if surgery is really successful, or operation is really successful, you know that the person might not need an eye drop. Okay. Why I've said they might not need, it's because a few cases, you can have surgery not being 100% successful to lower the pressure, but at least in those cases you need a patient to continue with at least one eye drop, which might be manageable, than having a group of eye drops trying to lower down the pressure, and each eye drop is really sometimes very costly and not even available in the villages out there. Sometimes people have to travel long distances to go to a center where they can find those eye drops, and sometimes they are not readily available, except for us, because we are a comprehensive center. We have many variety of anti-glaucoma drops, like in stock, so you won't miss out at least to have one. But surgery is one of the management, but also there is laser. There is laser where they're using light to try to create a passage through the window of the eye, and that helps to drain out the fluid. But for the management for glaucoma, it has to be all around, because we know that studies show that most people, 40% vision is lost before someone notices it. It's not all about the medicines and your interventions, because all that we do very well. In Mengo, we do it very well, but also we have our low vision unit. We call it low vision unit, and it's a unit within our eye department, and what it really does, it does the rehabilitation part of our patients, because some of them have really lost vision, some of them have tunnel vision, just like you've seen in the picture. It's like they're looking through a tube, all the side vision is gone, and some of them have a lot of mist in their vision, and then they need to live on. So the reason why I've said that our management at Mengo is comprehensive It's because we have even the low vision department. It helps us a lot with rehabilitation, and that is also part of management, whereby those that are still actively reading, where we can, we have magnifiers that are given to them to try to magnify whatever they are reading, if they're still interested in reading. We have some of them that are really end stage or advanced. We still also rehabilitate them through the White Cane program, and also orienting them how to use it, how to navigate through life. And for the children that have low vision, our low vision department has been so much in collaboration with the blind schools, because many times when you tell someone we cannot do anything about them, actually for glaucoma it's very emotional sometimes, and it takes courage to break the news that we cannot do much in terms of vision, but our low vision department has been of use because they collaborate with the blinding schools, and they counsel the mothers to know that these kids need to still go to school even when the vision is very low. Currently also what they are doing for children that have low vision that are a bit older, we do a lot of writing of letters to the schools, such that for those that are still have relatively good vision, we write letters to the school through our low vision department, and those letters are really helping even to the examination boards when the children are going to sit, such that these children are not left out just because a disease came in, it was treated late, and there is vision loss, but also we really advise a lot in our counseling about large prints. One of the things that is really affected in glaucoma is the night vision, because one of the places that is affected is the cells which control your night vision. So in most cases we try to counsel them about using of a point torch to act as a way to help them to be able to navigate, but also we do a lot of counseling. It's emotional, just as I've said, because sometimes you have a scenario, someone is a driver and they have come, they didn't know they have glaucoma, and then you have to tell them this is a job you can't do anymore. And it's so emotional, and we do our management in the Mengo. It's not a one-off. It is a continuous thing, and for us in glaucoma, you have to talk. In our glaucoma clinic, you have to talk, and they ask you sometimes the same question, and you have to talk. And then the other thing that I wanted to mention about is that many times people get tired of taking care of this glaucoma patient out there in the community, and that is where the disease becomes a burden. But we have to know that this eye pressure disease has a trend. It has a genetic trend that the people who are more at risk are the people that have family history of eye pressure disease. So having a history of eye pressure disease makes you risky, but we shouldn't confuse it. Because anyone can get it, as I said, but those that are highly at risk are the people that have family history, and that's where sometimes we have to counsel them with their relatives, and people that have family history of glaucoma, we usually tell them to have an annual check. We look at your nerve, how it's looking, and we measure your eye pressures, and we see how we are. And this, when we talk about it, looks like something that is just there, slight. But we have very many families currently attending our clinic whereby siblings have the disease. One of the parents had the disease. And so right now glaucoma is becoming very, very, very outspoken and common, because people are now getting sensitized to know that there is this thing which will blind you. But how you get to know it's there, it's for you having an eye checkup. So the management is not really the eye drop only. We have the eye drop, we have surgery, we have laser, but we have also the rehabilitation part of it. How does someone go out and live with that little vision or no vision that they have, really?
Briefly, as we are coming to a conclusion, basically you mentioned a lot of things. Maybe what I want you to give us a highlight about when it comes to daily care. How have you encouraged these patients with this disease to take care of themselves? And secondly, does this normalize have an effect on these patients? This normalize like the ones they have in our houses, or for them they are normally okay? Because talked about the torches, I don't know which other.
Let me start with the daily care. The daily care. Our daily care for glaucoma usually entails the medication. The medication for glaucoma is not all about applying the medicines, but it's all about consistency of the application. It's all about consistency, the frequency as per the indication of how frequent you should apply it consistently. Why we talk about that in daily living, it's because once people come for the checkup and they are diagnosed or told they have this high pressure disease, sometimes if even when you've tried to explain a lot, sometimes there are a few individuals that may not really understand the repercussion of what you're talking about. And you find that someone will come for the treatment today, and then they will miss out their treatment for like 3 months. And then when they miss out, the pressures go high again. So they come back at their convenience. So the daily living with glaucoma entails a lot of dedication and counseling of the patients to know that this eye drop, if my intervention is the eye drop, I have to put it every day of my life.
How many times? Is it once or depending?
Different medicines have different number of times you put them. That dose you find the application is once a day. That dose you find it's twice a day. That dose that you find it's 3 times a day. So living with glaucoma entails daily application of your eye drops. If you're on an eye drop intervention, it entails a regular eye pressure check, like you've seen on the picture we have, the eye pressure check with that machine, because it's not, it's not important for you to put the medicine when you don't know where you're standing. So all the things we do in daily living of glaucoma, they are all circled around maneuvering with the eye pressure in someone's eye. How do you lower that pressure? That is what they are all about. So the daily living with glaucoma means frequent application of your medicines. It means doing it consistently. Those are some of the tests that we do to confirm the disease. It means consistency in putting the medicines. It means checking out how the pressure is standing. And the only way you can check out how your eye pressure is standing is by coming for a routine checkup, depending on how your pressure is standing. Currently in our eye department, that is the eye pressure check. And currently in our eye department, we are trying to build this clinic even better, and we are trying to develop protocols on how to manage it. For example, some of the protocols are not yet written down, but once we find that the eye pressure is consistently controlled, our normal eye pressure, by the way, ranges from 10 to 21 millimeters of mercury. 10 to 21, beyond which we can suspect. But we have to know that usually for treatment, we only treat if we have done every checkup to confirm. So in our department, one of the protocols, we do not treat or give medicine in glaucoma unless we have confirmed the diagnosis, because we know that a person has to live all their life putting this medication. So we don't treat or give medicines until it's confirmed.
Okay.
And also the other thing that we should encourage people not to shun away from this test, especially especially in the Mengo Hospital. Yes, we can't say Mengo Hospital only, because not everyone can really access those that are far, but at least in regional referrals, even under the government, most of them have established eye clinics, which people do not go to. So whichever nearest eye clinic is close to you in the hospitals, major hospitals near you would be of good help. Okay. But for those that are around Mengo, the reason why Mengo is good, not to just praise, but people who have been there can testify, is that though our images like taking, confirming, it is if you compare to other people around, our images are a bit affordable in comparison. Okay. In comparison to the general investigations done for glaucoma, ours is really on the lower side. Okay. I can't say it's affordable because affordability is highly individualized, but they are at a lower end. I would say they are really at a lower end. So daily living is all about daily application of your medicines rightly, routine visits to check how the pressure is standing. It's very possible for you to put the eye drops and the pressure is still high and you won't know, and then later on you say, they gave me medicine but I got blind. So it's not about applying medicines all the time, but it's also about checking out whether the medicine is really lowering the pressures we want, checking out whether the surgery is lowering pressures you want. So daily living is about lowering your eye pressure with medicines, checking out routine visits, how the pressure is faring, to see what other intervention they can do for you, we can do for you. But also, just as I talked about briefly about rehabilitation, that is under the daily living. We do continuous counseling of our patients. Some of our patients will really tell you, if I can try to read my Bible, for example, if I can try to read to see something on a phone. So sometimes we really do a lot of counseling with our low vision department. So it's also something you can check out if you're out there with a patient of glaucoma and maybe you're on treatment or you've lost hope that beyond this there is nothing. You can really visit our low vision department. We do a lot of rehabilitation, and that rehabilitation is what helps someone with daily living. Because for glaucoma we just start from where we have found it, and the aim of the treatment is not to really make your vision better. We can't make it better. We can't make it better because damage is permanent. That's right. But we can slow the progress. We can slow it from getting worse.
So should we say they have no hope of fully recovering back their sight?
For glaucoma, you can't recover back the sight which is lost.
So should we say it requires a miracle?
Yeah, it requires a miracle from God. Actually, I can say it's only God who can do that. Otherwise, that's why we say that it's the leading cause of irreversible blindness. We know cataracts and refractive errors, just like you mentioned during our introduction, that the leading two causes of blindness. But for particularly blindness where you can't reverse, it is glaucoma. It is eye pressure disease, and that's why it's so much of concern. Some of us who have worked with the patients, it's a good experience because we appreciate. You appreciate the checkups, how important they are. Surprisingly, we have patients who have got, for example, foreign body in the eye, and they have come to remove it, and then when you're looking, you say, "I've removed it, but let me check your eye inside." And then you found there is glaucoma. There are people who have ended up with a diagnosis that it wasn't meant for. Now, that is a one-off because they came because of another thing. But just imagine how good it would be to rescue vision loss if someone did a routine and it's discovered because they came in and they said, I want an eye checkup that is complete. How beautiful would it be if you're saving vision which hasn't yet gone? I think it's more beautiful to do that.
Are there directives that you give to these kinds of patients when they go back home to the communities, because a lot of things that happen around the communities while you are not there as the doctors or the nurses? What are they supposed to avoid when they're out there in their homes and the working environments? And the environment, talk about the weather changes, the wind, so many things that come across. You see someone with a hanky, the tears, I don't know how what are the tears? The tears.
In layman's language, you can talk about the tears.
Yeah, something called, you see someone is fidgeting with an eye. So what are they supposed to avoid?
For particular glaucoma, as our discussion, for our patients, what they should avoid, some of them it's not complete, you can give a whole package all through in one moment, but one of the things that we advise is to be careful about eye injuries. Eye injuries, because you find that sometimes someone has glaucoma, one eye is gone, and they have one eye which is relatively good per se. And just imagine if you get the injury on that only eye, what it means. So it's like if you have any other illness, if you have, for example, hypertension, doesn't mean that you can miss out getting malaria as per se. So even with glaucoma, you find that someone has glaucoma, but they can always get any other eye condition. For example, the injuries. So sometimes we do a lot of counseling about prevention of injuries. Sometimes we give glasses, not because they are so much improving, especially for those that have only one eye remaining, but we give it as protection, such that even if there's something which has been thrown to hit the eye, the impact is lessened when it reaches the glass. And that is especially for people that might be having one eye, or those that have reduced vision but not completely gone. And also you've been talking about handkerchiefs and what they might not be bad, but in most cases when it comes to our eye hygiene, it's all about the hand. So if you can keep your hands clean and you're not touching your eyes all the time, then you limit getting other issues like the eye infections, which might be another burden. When they're out there in the community also, we, just as I've told you, some of the things we are doing with our low vision department is collaborating with the blind schools, or low vision schools, and we usually incorporate the mothers that have never known. And for me, I might not know the detail, but our low vision unit, they have actually the contacts to the different schools that are for the particular eye care special needs. So our low vision unit, just as I've said, that you can visit it, it can be of help. Because you'll be surprised to find very many parents whose children have low vision and are studying and are doing well. And we have even those at the university. Currently, this August, universities have been enrolling for the first years, and I've been going to the low vision unit for some reason, and you find there are people, they are writing 4 letters to the university recommendation because of the vision impairment, and these people are studying. So the awareness is for our patients. It's all about counseling them to know that there is help just beyond the vision they have at that particular point in time. And also what we are doing with the community is we always tell our patients that have come that they need to, for example, if they're old enough, they have kids, we do a lot of telling them to be our mouthpiece out there, because sometimes you might not have all the funds to go door by door, village by village, but our patients have been our mouthpieces. They have told their relatives about the disease, and many of time these days we have got a privilege. We've got very many clients coming in and telling us, you know what, my mom told me I should come for checkup. My sister told me I should come for checkup. So I think it has been a good mouthpiece for us, how much we explain to our patients what is happening.
All right, time has cut us short, but of course the information is more, and we should still have you back to discuss what hasn't been revealed yet. However, this is wisdom and knowledge to urge all those victims, all the public, all the citizens of Ugandans, whatever you could be watching us from, Mengo Hospital is the way to go if you're having such kind, if you sense like your eyes is not all that stabilized. You need to go to Mengo Hospital for a checkup and rescue your life as earlier as possible. My name is Ritah Nandera, and I have been with Dr. Lilian. Yeah, thank you so much for being with us, and allow me to wish you a blessed Thursday, and so many programs are coming up.
This is Church of Uganda Family TV. Enriching lives. Regulated